Hello, this is Dr. John Nelson, and I plan to review with you over the next few minutes our methods for survey distribution and data collection for our international study that will test a model of nurse job satisfaction. Included within this review are the different methods for survey distribution and data collection. It is important to be able to consider which method will be most operationally feasible for your organization to make sure that we enhance the response rate as much as possible. The first two that utilize database of names will provide for the most specific and detailed data, hence will be the most we can do with from a scientific point of view. The last three, we still will be able to compare units, wards, and demographics, but because of the lack of detail that is collected within the process, there will not be as much that we can do with scientifically. These are things you need to consider as you select your method of distribution. This first method utilizes an upload of a database of names, and an email will be sent directly from healthcare environment. This is the most common method of survey distribution from healthcare environment because it is the easiest and it provides for the most detailed data and hence the ability to evaluate the data most deeply scientifically. It includes 8 types of data, including providing the service line for the potential responder, the unit or ward, the employee's number, that could be like a class code or an employee code. It also includes the last name, first name, job title, role, and email. This is a confidential process and not anonymous. Some organizations do not like any chance of identifying who it is, even if it is only the primary investigator that can identify. So consider that as you are evaluating different methods of survey distribution. As stated before, it does provide for the deepest level of analysis. It is the most commonly used. It is the easiest for the responder because it's an email that is simply sent to them and they select the link. And we are also able to monitor response rates in real time. Being able to monitor the response rates in real time helps us to understand where we might need to provide more support at the unit or ward level. This is a sample template of the Excel file that will be used to populate the database of names for upload. You will note that there is unit, service line, employee ID, last name, first name, title, role, and email. Anything that is not applicable, such as email, simply place NA to state that it is not applicable. The only number that is absolutely needed is the employee ID. This will be sent to you if this is the method that you are selecting. Human Resources is usually able to provide this information, or unit and ward managers populate their respective units. Once this Excel file is complete, send it back to me and I will upload for survey distribution. This is an example of what an email looks like for any potential responder that you send the survey to. You will note at the bottom of the email there is a link. They would select that link and respond to their survey. They can save and return to their survey as often as they would like, but once they get to the end and select submit, they will no longer be able to access their survey. During the period of survey distribution, you will be able to use the Report Center on the Healthcare Environment website to monitor your response rates by unit. Here is an example of what that report looks like. You will note there is the name of the unit, the number that were invited, the number who responded, and the corresponding response rate. This will help you know where you may need to go and provide additional support for survey response. At the top, you will note that there is the total number of responses total number invited, and the total percentage to that point in time. These data are in real time. This is the second method of survey distribution and data collection. It also utilizes the database of names that will be uploaded, but instead of using the internet and email, it utilizes a link and the organization's intranet to distribute the survey. It also requires the same 8 pieces of information, service line, etc. It also is confidential, not anonymous. It also provides for deeper level of analysis because it does collect detailed and specific data. It is fading in use because more people do prefer the email process, and it is slightly more difficult to use because it does require the employee to enter 4 specific pieces of information to access their unique link. Similar to the email process, these same data will need to be collected utilizing the same Excel template. On the top of this slide, you will note that there is a link. This is the link that the organization will send out to all potential responders using their intranet. Once the employee receives and opens their survey, they will see this screen as noted by the survey login. They will enter their last name, their first name, the employee ID, and the hospital that they're working within. If they do want a copy of their survey responses, they are able to provide their email address, and a copy of their responses will be sent to them. Once this information is entered, they're able to log in and access their survey. Similar to the previous method, they can save and return as often as they would like, but once they submit, they will not be able to access their survey again. This generic link is another method for survey distribution and data collection. It is easy to use as it does not require the employee to enter any data. It is probably the second most commonly used next to the email process. It is anonymous, and thus we will not be able to do some of the deeper analysis that we can do with the previous 2 methods of survey distribution. We still can compare demographics or anything that was provided in the survey itself, but we will not be able to monitor change using within subject analysis. We will only be able to compare differences using a between subject analysis. This method is also very good to use with paper surveys. When paper surveys are used, someone will need to enter the data, and oftentimes organizations will use the generic link in combination with paper surveys. At the top of this slide, you will note that there is a link. This is the link that will be used for those who are using the generic survey method. If we do use the generic link method, we will need to decide on a code for this survey instance. Once the employee selects the link and opens up their survey, they will see this screen and need to enter the code for that survey instance. If they want to save and return, they will need to enter their email address so the computer knows where to send the link for their specific survey. So then they can re-enter their survey as many times as they like until they submit. Similar to the others, once they submit, they will not be able to return to their survey. The next method of survey distribution that I'm going to review with you is paper surveys. This is fairly commonly used still, especially for those organizations that have yet to transition from paper to electronic. It is easy to use, but it can be cumbersome to keep track of all the hard copies. This method can be either confidential or anonymous, but it does require additional staff to be able to transfer the data from the paper copies into an electronic format using the generic link or some other method of data entry. This last method that I'm going to review with you is the HTML document that will provide several ward or unit specific links for you to transfer your data from your paper to the electronic format. The research support staff or volunteers will utilize this document to make that transfer. If you do decide to use the HTML document, I will send it to you in an email. You will note in this example there is an attachment. That attachment contains all the links that you will need for your ward or units to be able to make the transfer of data from your paper to electronic format. This slide shows you what the document will look like once you open it. You will need to select the link noted here for you to access your unit or ward specific links. This is what the HTML document will look like once you select the link to view your ward or unit specific links. You will note that the surveys that have been submitted and completed are noted by the word complete at the far right. Those surveys that have yet to be used are noted in a blue underlined highlight. The next unused link can be selected, data entered, and then submitted once complete. Similar to the other processes, once submitted, you will not be able to re-enter that data. There is an option if you do want to re-enter the data for us to use preliminary survey, and you will be able to re-enter that as many times as you'd like until the survey is actually closed. We will plan on using the complete method unless you let us know. Thank you for your time and your engagement in this study. If you do have any questions at all regarding survey distribution and data collection, please do not hesitate to contact me at the email noted on this slide.